My name's Lee West. I'm 46 years old, an Army veteran, and I came in touch with the combined healthcare roughly around 2010, I think was the first contact. I left the Army in 2000. I joined at 16, so I'd done 10 years when I left at 26. I was very lucky to be offered a good job, but I was looking because it was really depressing me and making me feel quite ill, because the job I was actually a combat medic, basically a paramedic, but trained for wartime, instead of dealing with things like depressive mood and old people, we were dealing with things like blast injuries and shotgun wounds and traumatic amputations and things. I'd got a lot of back problems because I'd had injuries during the Army, and also this, I didn't realise at the time, was PTSD. I went to the GP because I knew I had an issue long before I left the Army, but being in the Army, it's very difficult to bring it up and to talk about it with your colleagues or anybody. So, as the Army would say, it was soldier on. And when I came out, again, I was in denial, and I just kept putting it to the back of my mind. I kept having dips, sort of peaks and troughs of depressive moods and nightmares about things in the Army. One in particular, I had an incident, and I just felt, I don't want to go on. What's the point? So the GP sent me to the access team at the Harplands. And I was interviewed, I believe it was a social worker, if I remember rightly, but Martin Donlan was brought in as he's a veteran from the Navy, and he talked about a group that he was running at the time, and basically that's how it kind of started from there. I've been on ward 2-3 times, I think, and on ward 1 once, which was the most recent. But the staff, just amazing. They deal with so many different types of illnesses, and there's so much going on. Right down from the domestic staff, doing the cleaning and things, and they're always extremely well mannered, and do you mind if, and knock on your door and things, and they're absolutely great. And then the care support workers, just ace, love them to bits, the brill. The things they do, the ward activities and what have you. So after a while, I drifted away again, and it was only in 2017, late 2017, I saw the GP and asked to be referred back to the Greenfields. The turning point for me definitely was having Jason Snape choose me or take me on or whatever. And I've never done it before. I don't know. There was just something about him. I don't know what it was, but I just absolutely broke. I was begging him to help me. I said, please help me. I was crying, and there was snot, and there was coughing, and then Jason had to get an extra pack of Kleenex, and it was really emotional, but at the same time it was like getting something off my chest that I needed to. And he stood and he listened, or sat and he listened, and then he drew, it's another terrible drawing, but he drew a brain on the whiteboard. And this thing in the brain, and he pointed out the bits and why things work the way they do. And I was taking it all in, but I took a photograph of it, and I've still got the photograph on my phone. It's still there, and I still look at it now today. And I think that was the catalyst. And at the end of the meeting that day, I said, I promise you 100% effort from my side, if you'll please help me. And since then, he's been absolutely superb. We've had a number of instances, and he's never pushed me. He's always let it come out in his own time. I had a home worker, support worker called Anne Hill, and she was amazing. She worked so well with Jason, and because obviously they're conversing all the time about what's going on, the team that I had around me, I don't work with Anne anymore, I work with a chap called Dave, and again, he's superb if you need anything, or if you just need to call him. So the team, I can't fault the team at Greenfield, are fantastic, including the receptionist. Because the first few times I went, even the receptionist, it felt odd. But there was a young lady called Beth that worked behind reception, and she's moved on to something else. But the ladies that are there now, fabulous. They're so welcoming. They're so calm, so kind, so non-judgmental, and it makes a difference when your brain's going, you know, you're mental, you're going nuts, you know, you're not normal. And to be received like that makes a massive difference. I think I was discharged on the Tuesday, and the appointment was made for the Friday to go and see this chap. And I went there, and I sat there, and 45 minutes after my appointment time, but bear in mind that I was there 10 minutes early. What I didn't realise was the chap who was dealing with me had walked past me on 5, 6, 7, 8 occasions, and at no point had he said to me, I've got an emergency on, I'm dealing with this, I'll come back to you. And with a military mind, being late was never good anyway. And the amount of times I felt, I'm going, I'm just going to go. I didn't, I stayed. And eventually he came to me and he said, right, if you want to come in, no apology for being late, no reason, no explanation. And then I was in the room with him for perhaps 5 minutes, and I think he asked me 2 questions. I just didn't want to engage with the guy. If I can only point that one incident out of all the help that I've had from the Combined Healthcare Trust, that's pretty bloody good. There's a big gap between the Ministry of Defence and the NHS, and I have, over the last few years, started to make steps towards bridging that, because I don't believe there should be a gap, and I do believe the reason my symptoms are as bad as they are, have been as bad as they are, is because the MOD, once somebody leaves, basically just say, well, if they've got a problem, it's the NHS's issue now. But the NHS isn't trained to deal with people that have seen active service. There's still plenty of people that won't come to the combined healthcare veterans because they don't believe you understand. You don't get it. You don't understand us. You don't get it. And they're the ones that are most likely probably to take their own lives, because things will just keep getting higher and higher and higher and higher in their brain, and sooner or later it overflows and bang. When you present as a veteran with mental health disorders, I believe you need to have a veteran who's had that similar sort of experience to talk to. Not just somebody who's served, but somebody who's had the mental health. When there's a new veteran that comes into one of our veteran centres, or that I come across through friends, I can help them, because I could start talking in military language, or I could start talking about things that happened to me and get them smiling and get them joking and tease bits of information out of them. And it makes them feel a little bit more accepted, because in a military mind, you're weak. If you've got mental health problems, if you've got an injury, whether it's a broken toe, spinal issues like I've got, PTSD like I've got, or fibromyalgia or anything, you're weak. I think investment in not veteran welfare so much, but in veteran communication maybe might be a good idea, because the diagnosis and things like that is obviously the doctor's department, but to get them to talk about it and to be able to put it into NHS terms needs somebody that's, 1, lived it, and 2, had the treatment for it and knows what works and what doesn't. Because one of the things that Jason's always done, and I admire him, and I know I keep going on about him, but he's like my big brother in that I admire him, because whenever I've talked about something in particular, he won't straight away say, "What, what's that? I don't quite understand." He'll let me carry on, and then he'll either ask me the question then, or he'll go away and he will revise it, or find it, search it. And next time he sees me, he's more of an expert on it than I am, and that's great, because that's all you need. You just need somebody who can talk your language and somebody who understands. The amount of times I've just massive relief, a massive big breath of relief, because he said something that I get, and how he explains it to me is brilliant. But I would like to thank the NHS as a whole, thank the board and everybody that works within the Combined Health Service, in particular those that I've mentioned, the staff, and everybody's just been amazing. And I think a lot of people perhaps will moan about certain things, but they forget about the good things. And the more we can bridge that gap between the military community, the veteran community in particular, and the NHS, the better. Because I don't think it's that far apart. I think it just needs some links in there to pull it in a little bit. And as the understanding gets better, I believe that I really want our trust to be the first to get a grip of it and really show everybody else, well, this is how we've done it, and this is how it's done, and you can do this as well. Get the numbers of suicides and things regards PTSD and veterans. Get it down. Let's get it down. and let's get a lot more people helped, because the help's out there. We just need to channel it and get people not just signposting in that go, well, just go and speak to them, they'll help you, but hold a hand while they're doing it. Go and do it with them. I think a lot of veterans feel that because they don't engage enough, they don't follow things through, and that's where it falls down.